Hey everyone, so this week we're going to cover the neurological and mental status assessment. So, so I'm going to do like a brief rundown of the A&P of the neurological system, also known as the nervous system. So, um, to start things off, we have two types of nervous system. You have the central nervous system and you have the peripheral nervous system. Okay, so of course the CNS is comprised of the brain and the spinal cord, also known as the spine. So brain and spine. Just remember that for the CNS. And then for the PNS, it's just outside of the CNS system, so it's outside the brain and outside of the spine. Okay, so we got that, and so within the brain, there has like certain regions. So you have the cerebrum, the cerebellum, the brainstem, and the spinal cord. Okay, and then what protects the CNS system? You have the blood-brain barrier, the skull, and the vertebrae. So when you think of the nervous system, one thing comes in mind: the brain. So it is a network of interconnecting neurons that control and integrate the body's activities. So it's like the powerhouse, the mastermind of all of our movements, involuntary, voluntary, sensory, motor. I'm going to get to that in a bit. So let's start with the basics, okay? Neuron. A neuron is a nerve cell. It's the basic building block of the nervous system. And it comes with three parts of it. So you have the cell body, you have the axon, and the dendrites. So, cell body, that's pretty much the body of the neuron. The axon is like the nucleus, if I'm not mistaken. And of course, the dendrites. So you have, these are the dendrites. See, this is the dendrites. Now, how do they communicate? So they have this thing called a synapse. So that's when one piece of information gets transferred to the another piece of information. So dendrites. So you have the dendrites here. The space in between is the synapse. All right. So let's go over the parts of the brain. So you have the cerebrum. Of course, that's the largest part of the brain. That's responsible for all voluntary activities of the body. So voluntary activities is like it's pretty much up to the choice of certain movements, voluntary, and then involuntary is just required, like just like that. So you have two hemispheres. You have the left hemisphere and right hemisphere. Left side controls the language, analytic abilities like math and logic, and then the right hemisphere is more on the visual, spatial skills, emotion, intuition, musical, and artistic abilities. Now, I just want to remember something, okay? So, left side, right side. Left side controls the right side, okay? Right hemisphere controls the left side. It's not left and left, right and right. No, it's left hemisphere controls the right side, and then the right hemisphere controls the left side. So, one thing to keep in mind. Okay, so the cerebrum, so that's an intricate fabric of interconnected neural cells that covers the cerebral hemispheres. It's the body's ultimate control and information processing center. All right. Now, let me ask you this. How many lobes are there in the brain? Okay, it sounds like a controversial question because although we know there are four lobes, and yes, we do have the four major lobes, the textbook says we have five. Some says six if you were to do some Google. So of course, the four lobes, you have the frontal, you have the parietal, you have the temporal, and of course the occipital at the back. Before I go over the functions, I just want to point out that okay, so the book says there's a fifth lobe known as the limbic system. So I'm going to show you what that looks like right here. If I can open up this picture right here. So if you guys can see it. So that light green area right there, that's the limbic lobe. So according to the textbook, that is the fifth lobe. But when I had my anatomy physiology course, so I was prior to moving to HPU in 2021, I was a student at UH Manoa. And I took a physiology course there, and they told me that the fifth lobe was actually the insula. It wasn't the limbic lobe, it's the insula. So I'm going to show you what that looks like here. So of course the brain, first of all, the brain has a lot of sulcus, a lot of gyri. For the insula, yeah, if you were to open a certain sulci of the brain, okay, I'm gonna show you like this. So if you were to I don't want to say rip, but if you were to remove this layer right here, you have this inner section. So that's the insula. That's pretty much the hidden lobe. So let's go over the functions of the four major lobes. So of course, again, frontal, parietal, temporal, and occipital. Frontal lobe is responsible for the orientation, memory, insight, judgment, arithmetic, abstraction, verbal, written language, and voluntary motor function. Okay, and then the temporal, it's for hearing, speech, behavior, and memory. Occipital lobe, that's responsible for only for visual processing. One way to remember is the spelling of occipital, O-C-C. Well, first two letters are O-C. You guys remember what binoculars are? Remember when you go exploring and then you have to use a binocular to see up close? Binoculars, B-I-N-O-C. Oh, O-C. So that's one way to remember it. Occipital, vision, binoculars. You need that to see, to focus on the vision. So that's one way to remember it. All right. And then for the temporal lobe, okay, so we know it's responsible for the size, shape, texture of objects, and interpreting touch, pressure, and pain. There are two certain regions in the parietal lobe. So you have the Wernicke area and the Broca area. Wernicke area, so that regulates the spoken and written words. One way to remember is Wernicke starts with W, word starts with W, so I think W in Wernicke and in words. So one way to remember it. And then the Broca area is basically the verbal expression and writing ability. Now let's go over the two lobes, hidden lobes, that we probably didn't know because we are so focused on the four major lobes. So the limbic lobe, so that's according to the textbook, this textbook, all right? So according to that textbook, it's responsible for the emotional state, so affection, anger, and sexual. And then the memory, of course, so you have pleasurable memories, unpleasant memories, and dangerous events. And then the insula, the one that I mentioned earlier, it's responsible for taste, visceral sensations, autonomic control, and vestibular control and equilibrium. So, so let's see what else we can talk. Okay, so of course there's the thalamus and the hypothalamus, certain regions of the brain. So the thalamus, the function of the thalamus is serves as the sensory relay station and gatekeeper for motor and sensory stimuli to the cerebral cortex. And then the hypothalamus, it's pretty much the master area of the brain because it regulates the temperature, heart rate, blood pressure, sleep, anterior and posterior pituitary, the autonomic nervous system, which we'll discuss about that later on, and emotions. Alright, so we have as I mentioned earlier, certain regions of the brain. You have the brainstem, midbrain, there's the pons, there's the reticular formation, and the medulla oblongata. So let's go for the functions. So midbrain is important for hearing and sight. You have the pons, responsible for the sleep and arousal. The reticular formation, that's for alertness and consciousness. Medulla oblongata, so it involves heartbeat, breathing, blood pressure, and digestion. And some of the involuntary functions include sneezing, swallowing, vomiting, hiccuping, and coughing. Then you have the cerebellum. Okay, so that's responsible for balance and coordination. One way to remember it is cerebell. So do you know what a bell looks like, right? So it's like notice the shape is kind of like symmetrical. I just think symmetrical as like perfectly balanced. So I just think cerebellum, bell, balance. Okay. So So we're going from the CNS up to the PNS. So you have the peripheral nerves and the cranial nerves. So there's some couple of numbers to remember. There are 12 cranial nerves and there are 31 peripheral nerves. How are you going to remember that? Well, have you guys been to Baskin Robbins? It's like an ice cream store. So if you've been to Baskin Robbins, you probably must be enticed by the logo. So so this is what the logo looks like. What do you notice? If you notice, you have the number 31 right there. And then the ones in blue are 12. See that? 12 in the blue, 31 in pink. So this is one possible theory of why they do their logos like this is because, of course, Baskin Robbins, they have 31 flavors, and the 12 represents the entire year, 12 months. 31 flavors throughout the 12 months. Baskin Robbins. So think of the number of cranial and peripheral nerves as Baskin Robbins. So 12 months equals the 12 cranial nerves, and then the 31 flavors represents the 31 peripheral nerves. All right. So let's go over the 12 cranial nerves, and some of which may have some mnemonics to remember. Cranial nerve number 1, olfactory. So that function is just smell and smell interpretation, as well as peristalsis, salivations, and sexual stimulation. But one thing for sure, the smell. Okay. Number 2, cranial nerve number 2 is the optic nerve. So it function is vision, including visual acuity and peripheral vision. So just think of it like this: cranial nerve number 2. You have 2 eyes. So cranial nerve number 2, 2 eyes, vision. Okay, cranial nerve number 3 is the oculomotor. So the function is eyelid raising, pupil constriction, and some extraocular movement. So it moves upward, medial, downward, up, and in. Cranial nerve number 4, the trochlear, again another extraocular movement. So it moves, the eyes move down and in. Cranial nerve number 5. So there's like 3 certain branches for cranial nerve number 5. You have ophthalmic branch, maxillary branch, and the mandibular branch. The ophthalmic branch, of course, it involves the eye, so sensation to the cornea, conjunctiva, nasal mucosa, forehead, and nose. And then for the maxillary branch, you have sensation to the skin of the cheek and nose, lower eyelids, upper jaw, teeth, and oral mucosa. And the mandibular branch, as the name implies, the mandibles, your jaws right there. So that's the sensation to the lower jaw and motor function to the muscle of chewing. So, and as the name is mastication, not the other M word. Okay, mastication means chew. So that's for cranial nerve number 5. Number 6 is your abducens. So again, another extraocular movement. So it moves lateral. All right. Cranial nerve number 7 is facial. So it involves the taste and sensation of the anterior 2/3 of the tongue and soft palate, and it serves as the primary motor nerve for facial expression. So, and mnemonic again. So, just imagine spending a week at a spa. I mean, everyone has different mnemonics, but for me, that's how I remember. Imagine that spending a week at a spa. 1 week is 7 days. Imagine 7 days of facial. So with some cream, with some cucumbers on your eyes, and then microdermabrasions for 7 days. Don't we all need something like that, right? Self-care, right? So that's one way how I would remember it. Imagine it's a week at a spa. Facial for 7 days. Cranial nerve number 7. Facial. Okay. Number 8. Cranial nerve number 8 at the vestibular cochlear, or just simply acoustic. So the function is hearing and equilibrium. One way to remember it: cranial nerve number 8. What's the 8th letter of the alphabet? Yeah, H. What does the word hearing start with? Yeah, H. So cranial nerve number 8, 8th letter of the alphabet, H. H as in hearing. Hmm? Okay. Okay. Cranial nerve number 9, that's the glossopharyngeal. So the function is for the pharyngeal muscle to elevate to allow swallowing and speech. And then you have the parotid gland secretion, and for general sensory, so like pain, touch, temperature, function. Okay, another mnemonic or another memory trick to remember. So it depends on how you write your nine. So some people write their nines like this. This is how I would write my nine, like that. So just think of it by looking at the number 9. Notice the stick right here. Yeah, it's like a tongue. So you may not see it, but it looks like a tongue. If you were to write the number 9, this stem right here looks like a 9. I mean, it looks like a tongue. So, yep, tongue here, tongue there. Oh, sorry, tongue over there. So, 9. So just think number 9. Look at number 9. It looks like a tongue sticking out. So, cranial nerve number 9, glossopharyngeal, tongue is sticking out. Right? Number 10. Cranial nerve number 10 is the vagus. Sounds like Vegas. So, the function of it is to provide more parasympathetic innervation to a large region. The effects and some of the effects of the cranial nerve number 10 includes digestion, defecation, slow heart rate, and reduced contraction strength. So, again, everyone has their own different ways of remembering one of the cranial nerves. One way of how I remember number 10 is imagine winning $10,000 during your well-deserved vacation in Vegas. I know, it sounds like, okay, John, how does that relate to Vegas or cranial nerve number 10? Well, 10,000, cranial nerve number 10. Vegas, sounds like Vegas. And well-deserved vacation. So, if you're in vacation, of course, you're pretty much calm and just going with the flow. You're not in a sympathetic stage where you get all excited and everything. Here you're just relaxing, like a well-deserved rest. So again, well-deserved vacation refers to the parasympathetic effects. Vegas, the same thing, and then yeah, $10,000 for the cranial nerve number 10. Again, everyone has their own unique way of remembering it. And cranial nerve number 11, so you have the spinal accessory, so the function is swallowing and speaking, innervates the muscles that turn the head and elevates the shoulders. And then last but not least, cranial nerve number 12, so you have the hypoglossal, so the function is just tongue movement. Okay, alright. Now remember, I mentioned the certain regions of the brain, the cerebrum, the midbrain, medulla oblongata, and the pons. So, which of the cranial nerves operate those regions of the brain? So, for the cerebrum, it's cranial nerve number 1 and 2. So, those two nerves are responsible for the cerebrum control. And then, which of the cranial nerves originates in the midbrain? It's cranial nerves 3 and 4. Medulla oblongata, you have 10, 11, and 12. So these 3 nerves originates in the medulla oblongata. And then for the pons, you have 4 nerves. Cranial nerves number 5, 6, 7, and 8. One way to remember it. So if you remember doing cheerleading in high school, they all have their own cheer, right? Well, here's one way to remember. 5, 6, 7, 8. Who do we appreciate? Pons. Go Pons. Yeah, just remember that cheer because 5, 6, 7, 8. Cranial nerves 5, 6, 7, 8. Who do we appreciate? The pons, because those 4 nerves originates in the pons. Okay, and then we have heart and the abdomen. So what cranial nerves can provide motor and sensory function to the heart and abdomen. So just remember, it's only cranial nerve number 10. Okay, now we're going now to the meninges. So these are the 3 protective membranes that surround the brain and the spinal cord. So what are the 3 layers of the meninges? You have the dura mater, the arachnoid matter, and the pia mater. Okay, again, everyone has their own different ways of remembering, but for me, I just remember 3 things: Explorer, Spider, and Miss Universe. Dura matter, I just think Dora the Explorer. Yes, Dora, sound the same, yeah. And then Charlotte's Web. You guys remember the book, right? It's the story about the spider, and yeah. So I just think Charlotte, the spider, arachnoid matter. And you remember Pia, who was Miss Philippines? I cannot pronounce last name. It starts with a W for sure, but I just remember Pia, Miss Philippines, Miss Universe, Pia matter. So Dura matter, arachnoid, and Pia. Dora the Explorer, Charlotte's Web, and Miss Pia, Miss Philippines. But again, everyone has their own unique way of remembering. Okay, so since I mentioned about the cranial nerves, so you may notice that during the lab, when you're doing the head to toe, when doing the head, so you're gonna do some certain skills to determine if the cranial nerves are working. So for instance, number 7, cranial nerve number 7, can they smile? If there's anything going on with their smile, their frown, the brows, and when they show their teeth. Okay, and then, okay, so number 5, cranial nerve number 5. So here's a skill where you have to take a cotton ball and then you have to like, this is gonna check for cranial nerve number 5. So cotton ball on the ophthalmic, maxillary, and mandibular. So we're gonna do that on the lab, especially during the head to toe assessment. All right, and of course the cerebral. Okay, let's move on to the cerebral spinal fluid. Okay, so it's the fluid in the space between the meninges that acts as a shock absorber that protects the central nervous system. So just remember the CSF. It's a great shock absorber that protects the brain. Okay, and then you have two different types of neurons. You have the afferent and the efferent neurons. So the afferent neurons, those are the neurons that carries impulses towards the central nervous system. And then you have efferent that conducts impulses away from the central nervous system. So which one is motor and which one is sensory? I just remember the mnemonic, same as AME. So the sensory nerve is afferent. The motor nerve is efferent. And then you have the dorsal column and the ventral column. All right. So the dorsal column, this is a white matter track on the dorsal side of the spinal cord. So it carries information about localized touch, deep pressure, position sense, and movement. Whereas the ventral column is a ventral section of the white matter in the spinal cord between the ventral horns. So which one is afferent, which one is efferent in terms of the types of columns? So dorsal column follows the afferent. Ventral follows the efferent. So I just think Dave, D-A-V-E. Dorsal follows afferent, and then VE, ventral follows efferent. All right. And then, okay, so as I mentioned, the 31 peripheral nerves, so it goes through this division. Cervical has 8 nerves. Thoracic has 12 nerves. Lumbar has 5 nerves. Sacral has 5 nerves as well. And then the coccygeal, so that's the tailbone area, only have 1 nerve. So if you add the numbers up, 8, 12, 5, 5, 1, should come to 31. All right. Autonomic nervous system. So this is the part of the peripheral nervous system that controls the glands and the muscles of the internal organs. There are 2 types of autonomic nervous system. You have the parasympathetic and you have the sympathetic. So, sympathetic, we just remember it's fight or flight, whereas the parasympathetic is the rest and digest. Okay, I'm not sure if they're going to discuss about the neurotransmitter, but just in case, in the sympathetic nervous system, the main neurotransmitter is epinephrine, whereas for the parasympathetic nervous system, it's the acetylcholine. That's the main neurotransmitter. So we're going to learn about reflexes. You're going to learn about that in the lab as well. The most commonly tested reflex is the knee-jerk reaction. So at the lab, you're going to use something that looks like a triangle, and then you're just going to hit certain regions to check for the reflexes. All right, So Babinski reflex. So you can hear about that. It's mainly into newborns. So Babinski reflex is a reflex in which a newborn fans out the toes when the sole of the foot is touched. Okay. Alright. So yeah, all of this is in the Quizlet, alright? So yeah, you might want to look out for the title of those sets so you can follow along. Alright. So of course, as people age, there are certain changes into the system. Like for instance, due to the changes in the CNS and the PNS systems, so those older adults are more prone to falls, injuries, ischemic paresthesia in the extremities, poor balance. So poor balance, you might see it in people with Parkinson's disease and postural hypertension. And then hydrocephalus is one thing to worry about. So, as I mentioned, the cerebral spinal fluid, it's good as a shock absorber, but if you have too much of it, it leads to hydrocephalus. So some of the examples include some of the symptoms from hydrocephalus due to excess CSF include difficulty in waking up and staying awake, fatigue, headache, incontinence, irritability, jugular vein distension. Dr. Joe probably discussed that in the previous week, so here it is again. Loss of coordination, loss of mild dementia, personality change, postural hypotension, vision problems, and walking difficulties. And of course, stroke is involved. So risk factors include family history, hypertension, obesity, diabetes mellitus, smoking. So again, stop the smoking, please, and atherosclerosis. All right. Here. Okay, so we're going to learn about the Glasgow Coma Scale. So the grading components include eye-opening response, best verbal response, and best motor response. And then the score ranges from 3 to 15. 3 indicates deep coma, 15 indicates a normal score. Okay, and then meningitis. So remember, dura, arachnoid, and pia. Again, explore Charlotte's Web and Miss Universe, or however you would remember it. So again, meningitis, inflammation of the meninges, the brain and the spinal cord. The symptoms include high fever, stiff neck, drowsiness, and photosensitivity. And then I have on the Quizlet set, so I'm looking through it right now. There is a whole series of conditions to look out for. So Bell palsy, facial paralysis caused by a functional disorder of the seventh cranial nerve, cerebral palsy, loss of deficiency of motor control with involuntary spasms caused by permanent brain damage present at birth. And then I included Down syndrome. So again, that's an intellectual disability and associated physical disorders caused by an extra copy of chromosome 21. So again, it's a inherited kind of disease. Tremor is, you might want to look out for tremors because it involves the shaking. You might see that a lot in people with Parkinson's disease. And speaking of Parkinson's, it's a disorder of the central nervous system that affects the movement. And as I mentioned earlier, tremors are involved with Parkinson's disease. And a small kind pharmacology review. So Parkinson's disease is usually caused by a lack in dopamine. You have multiple sclerosis in there, fasciculation. Tics are involuntary movement of a small group of muscles. So it might be prominent in people with Tourette syndrome. So where they do some random twitching, uncontrollable vocal sounds, inappropriate words. Then we have dystonia, so that's a condition of abnormal muscle tone that causes the impairment of voluntary muscle movement. Huntington's disease, peripheral neuropathy. Okay. Yeah. So again, stroke. Excuse me. Stroke is a sudden attack of the weakness or paralysis that occurs when blood flow to an area of the brain is interrupted. Okay. Ataxia, sensory ataxia, loss of coordination caused by the loss of sensory input into the movement control. And then I added more like common mental, I don't want to say mental disability, more like mental conditions. So for instance, intermittent explosive disorder. So getting angry at the wrong place, right? So that's impulse control disorder involving an inability to hold back urges to express strong anger feelings. Yeah, panic attack, anxiety, anxiety. So that's emotional state of high energy with a stress response. That's the body's reaction to it. Sundowning, you might see it in some patients. So that's a condition of becoming restless and agitated in the late afternoon, evening, or during the night. And then you have the seasonal affective disorder. So it's a disorder in which a person experiences depression during the winter months and improves the mood during the spring. So right now, summer. I mean, it's not summer yet, but if in the summertime, it's usually sunny, so everyone's kind of like a little happy around that time. But then, as we progress to the fall and to the winter, there's not much sunlight, so that's when the disorder starts to come in, and then spring comes again, and then there's the sun, and then that's when things are going back to normal. Pseudobulbar effect. So this is laughing and crying in the wrong time. Let me describe, and then Alzheimer's disease. So this is a progressive and irreversible brain disorder characterized by gradual deterioration of memory, reasoning, language. So dementia is like memory loss. Alzheimer's is like the more severe form of dementia. And of course, depression. So that's a prolonged feeling of helplessness, hopelessness, and sadness. So, and then you have hysteria, temporary loss of cognitive or motor function due to results of emotional upsetting experiences. Bipolar disorder, so that's a mood disorder in which the person alternates between hopelessness and lethargy of depression and overexcitement state of mania. Okay, I included autism, ADHD, OCD or obsessive compulsive disorder. ADHD is attention deficit hyperactivity disorder. So those three are often involved with, I believe, involved with the neurological system, and it usually occurs mainly in the childhood stage. Okay, PTSD. That's a big one. That's an anxiety disorder characterized by haunting memories, nightmares, social withdrawal, jumping anxiety, and or insomnia that lingers for 4 weeks or more after traumatic experience. So, if you think of PTSD, one, one thing that suddenly comes in mind is the people who are in the military, because they have been faced a lot of sounds, a lot of traumatic events. So, it's one thing to look out for right there. So, vertigo, sensation of dizziness, tardive dyskinesia, added that, ALS, amyotrophic lateral sclerosis, it's one of them. Epilepsy, that's a chronic brain disorder characterized by recurrent seizure activity. Okay. Schizophrenia, cerebral aneurysm, seizure, so that's a sudden surge of electrical activity in the brain that allows how a person feels or acts at short for a short time. Encephalitis, CTE, so that's a progressive degenerative condition involving brain damage resulting from multiple episodes of head trauma. So it's more commonly in football players. So, like for instance, Cole Brennan is one of them, and then there's a whole list of football players that are affected. Myasthenia gravis, narcolepsy, parosmia. So that's pretty much losing the sense of smell, pretty much, or taste. Okay, closed brain injury, open brain injury, neurogenic shock, and then dysreflexia. So that's in a state in which an individual with a spinal cord injury at or above the T6, so that's the thoracic area, experiences it as uninhibited sympathetic response to the noxious stimulus. Then we have sciatica, spinal stenosis, cerebral vascular disease, and then their migraine, that's a severe recurring unilateral vascular headache, the Guillain-Barré syndrome. So this is an autoimmune condition that causes acute inflammation of the peripheral nerves, in which the myelin sheets on the axons are destroyed, resulting in decreased nerve impulses, loss of reflex responses, and sudden muscle weakness. So, and then there's like, I don't want to verify this as a true statement, but they're saying that vaccines are more like people don't like vaccines because they may cause Guillain-Barré syndrome. I believe that's not true. There's no scientific proof that it does. So if someone says, "Oh, don't take the vaccine, it's gonna give you Guillain-Barré syndrome," just don't buy it. Okay, just get the vaccine. It'll protect you in the long run. All right. So mental retardation. So the condition of limited mental ability. Mania delirium. It's a mental disorder marked by confusion, uncontrolled excitement. Wow. Oh, aphasia and dysphagia. Aphasia is impaired of language caused by left hemisphere damage. And then dysphagia is speech difficulty. Do not confuse aphasia with or dysphagia with dysphagia. So, by speech difficulty, the spelling of the condition is dysphasia, not GIA. That's dysphagia. That's difficulty eating. So remember, do not confuse that. All right. Wow. So yeah. So if you were to check the Quizlet right now, so yeah, I'm checking through the Quizlet. There's a whole lot of lot of conditions that you might want to look through. And then in the lab, you might learn about the scaling of the deep tendon reflexes. So you have 4 plus means very brisk, hyperactive response. 3 plus is brisker than average. 2 plus is average or normal. 1 plus is diminished, low normal, and 0. Of course, nothing happens or no response. Whew. Okay, and then I remember when I mentioned about the triangle thing that you. So now we know the certain areas that we can perform with the deep tendon reflexes. So biceps, triceps, they're all in the arm, brachioradialis, the patellar region, ow, and the feet, the Achilles. Okay, you probably see part of my feet already. So, and then there's some signs to look through, like the Brudzinski sign. So that's neck pain elicited by flexing neck downward, chin to chest. And the Kernick sign, so inability to fully extend the knees with the hips being flexed. So yeah. Oh, brain death. I want to mention about brain death. So this is a diagnosis of death based on the cessation of all signs of brain activity, as measured by electrical brain waves. So once the system inside the brain like completely dies off, that's when you know it's brain death. Okay, so we can detect it through the electroencephalogram EEG, so that's an amplified recording of the waves of electrical activity that sweep across the brain surfaces. And then another diagnosis you can do is a lumbar puncture, also known as a spinal tap. Okay, so yeah, I know it sounds like a lot, but hey, the neurological system, this is what controls our movements: voluntary, involuntary, sensory, motor. So remember, it's a powerhouse. It's in a brain. Whenever we think of the neurological system, the main mastermind is the brain. Right? So that's all that's, and then continue. So you can find more in the textbook. You can find more in the Quizlets, and then you can also check with your lab to see what certain tests that should be done to assess the cranial nerves and all the other fun stuff of the neurological system. So this is going to conclude everything. I hope you enjoy so far. Enjoy the presentation. So thank you so much. If you have questions, please don't hesitate to email me, and be sure to check the Quizlet set. So I have like about over 230 terms. I know it's a lot because we have a whole list of conditions of the nervous. Yes, again, the nervous system, the neurological system. This is what pretty much controls our actions, right? Again. Yep. So this is the conclusion of the A&P and other cool stuff of the neurological system. So enjoy the rest of the day, and aloha.